Welcome to my podcast. I'm going to talk about something I read recently. And after you introduce yourself, as always, I agree, double check the patient name, date of birth, ask the patient, how can I help you? The patient might state that I'm having headache for quite a long time, and I've tried every single thing that I've been told about, and nothing seems to work. They could have started with paracetamol, ibuprofen, codeine, and all sorts of painkiller, but nothing seems to be working. So I'm going to talk about one section of the headache, which is called chronic daily headache. It has been stated that it's kind of common and estimated to be 3.6% globally, with 2 million or more of people living in the UK alone. And it's often misdiagnosed and mismanaged, and it can be very debilitating and costly as well. It has been stated that there is like two forms established. One is evolved from pre-existing episodic primary headache disorder, which is fall in the category of migraine, and the smaller proportion started de novo and continue every day from its onset, and it's called new daily persistent headache. However, tension headache in a recent study has been considered uncommon and can be misdiagnosed and overlapped with migraine. So the treatment or management is always require recognition and managing the sustaining factors, which could include medication overuse, physical, psychological comorbidities. And it's always important to assess and investigate the patient rather than dismissing them or sending them away and assume it's only psychological. However, in order to treat rightly, we need to establish a proper diagnosis after taking a thorough, detailed history in order to know what's going on, and we have also to include a history of the current use of the medication, like the painkiller or anything over the counter. Also including if there is medication overuse, including excess caffeine intake, which is known to entail central nerve sensitization. We know that in the OTC sometimes you find some sort of painkiller with caffeine, or maybe the patient is drinking too much caffeine as well. So that's another thing to explore with the patient. And it has been suggested that any patient is taking paracetamol or aspirin or NSAID for more than 15 days per month, or the other group, which is triptan, opioid, barbiturate, or compound analgesia for more than 10 days per month. This is falling in the category of overuse headache. So you can see with just this limit of taking any sort of dose I just stated, the painkillers can fall in the category of overuse headache. And of course, other conditions can contribute, like psychological comorbidity, like anxiety, depression, sleep disturbance, either too little or too much, and also the possibility of physical comorbidity, like hypertension, obstructive sleep apnea, stress, head injury, and also obesity. All of that can be contributing, and also certain connection has been found that certain condition can cause sensory signal, abnormal sensory signal in trigeminal or in the cervical region, like C2 and C4, when the pain arises from the neck. If I'm going to take myself as an example, and I have this problem with the neck problem, and the area around, all the area around the shoulder and the scapula, and now I'm talking and I'm having pain in the right scapula. I can feel a muscle spasm, and it's really, really painful. There's nothing I can do to release it, even if I try to pressure it, or I'm just putting heat pad now in the hope that it will release for some time. But it's episodic. I remember since maybe like 1 month or half, I had it for like 3 days, and it's really debilitating. You can't even do anything about it. So you can imagine that, and it's always associated with left side headache. That's for my condition. I'm just trying to give myself an example. However, everyone differ, and they have different presentation, different symptoms. We need to try to look for, of course, solution, because it can be quite detrimental to be living like this. However, now I'm going to come back to the topic, and it has been stated that in those kind of conditions, when you explore with the patient who says that they are taking multiple painkillers and nothing seems to work, it has been stated in a recent study that complete cessation or stoppage of medication overuse offer a higher success rate unless the patient is overusing opioid or benzodiazepine or barbiturate, which obviously it needs a structural withdrawal process. And a recent Norwegian study found that reducing pills intake from 22 to 6 times per month offer a good way to stop chronic headache. So as you can see, some patients might reach like more than 22 pills per month, which can be too much, of course, especially with the cocktail of the painkiller I just stated. So in that situation, it won't help, but seemingly aggravating or exaggerating the whole situation. So as I say, it's only about one chunk of the headache. Of course, I didn't rule out other causes of headache like space-occupying lesion or the cluster headache. All of that I think I stated before in another podcast. Let me know if you have any comment or if you would like to share any of such a thing or have encountered, or if you have it yourself, and I will come back to you. Thank you.